Okay. Καλημέρα σας, κυρίες και κύριοι.
Good morning, ladies and gentlemen.
We're all set? It's a pleasure to be here with you today. It's an interesting time in visiting Greece and seeing this first convening around issues of homelessness. It really marks a starting point of a conversation that is timely, and I'm very happy to be part of it. I am Greek, but I will not be speaking Greek because I've been working mostly in the States, and so the language challenge, as years roll on, erodes. But in returning here and seeing the changes over the last few years, my experience in homelessness in the States over the last 25 years, even though it has been in a very different cultural context and social context and political context, there have been a number of experiences and lessons learned during that time that might be useful to add to this conversation, which is already rich with many ideas about the role of philanthropy, the public and private sector. Yesterday's conversation was illuminating, and I am a little, I have to say, out of my context here as a clinical community psychologist and a program provider, essentially. What I hope to do this morning is just to describe the work of programs around homelessness, especially the ones I've been most involved with. And my understanding of the role of philanthropy is really as a recipient of philanthropic grants or a collaborator with philanthropy to launch projects in different places around the country, around the world, really. So that's my sort of background. Even in the title of addressing homelessness during the economic crisis, we have talked a little bit about how is this crisis different than other crises and so on. And the current crisis here has sparked the conversation about homelessness. The numbers have been increasing unbearably high very quickly. The economic crisis that started homeless programs, or even the homelessness industry really in the United States, goes back to the 1980s. 1980s, Ronald Reagan had just become president for the first time. Just to take you back to that context, there was a lot of investment in supply-side economics and trickle-down theory, which people warned might not be that helpful. And the emergence of homelessness is credit, really, to that administration. We didn't have homelessness in the United States before 1980. At the level in which it has reached. And so the emergency response to homelessness in that country, 10 years later in Canada and then in Europe, has been the result of some of the underlying much larger economic and political decisions made at that time. This is a very simple graphic of something called the Gini coefficient, which I find sort of a useful index. People talk about this in homelessness research as something that's correlated to societal levels of homelessness and social service responsiveness. The Gini coefficient really refers to, Corrado Gini invented it as a statistician that looked at numerical distributions of numbers. It's used now by sociologists and demographers to measure the income disparity in a nation. And each nation, you could look up, has a Gini coefficient. And the Gini also is correlated, we have found more recently, with numbers of people who are homeless and the investment in social services and other programs in a country. Just in a rough way, you can see that Canada, Europe, Australia is in the 30s or so of the correlation. The United States is purple in the mid-40s, approaching 50s. In the period that I'm talking about, between 1980 to today, the United States has increased its Gini from like 0.35 to 0.47 today. And the income disparity, I think, was most accurately captured in the Occupy Wall Street, sort of the 1%, 99%, a signal of the fundamental causes of many of the issues faced there, unemployment among the young, similar to here, and homelessness and the rest of it. So, I mean, we're going to talk about homelessness, and there are many attributes and characteristics that describe homelessness, but fundamentally it's about poverty, and poverty is about income distribution. So it's very useful to keep that as the background. Here's what the Fianza group says about Greek homelessness. Fianza is a federation of organizations that studies homelessness across Europe. The data, they say, is sketchy. Very, very difficult to enumerate the number of homeless people because it's a constantly shifting number. Best estimates are about 11,000 street homeless in Greece, 3,000 of them Greeks, 8,000 foreigners. The definitions of homelessness that are articulated there are used throughout Europe. Roofless, meaning really the street homeless group, people living in makeshift settings like shelters and institutions are the second, and then the other categories, insecure and inadequate housing, really refer to people who are housed but with families or relatives but not stably, not their own place, don't have a secure tenancy, and not affordable. The interventions, as you can imagine, for these groups are different. Some are prevention, others are outright intervention where you have to go, do street outreach, bring people into housing, provide medical and other kinds of care, economic support, so that your typology of homelessness will also guide what needs to be done in terms of what the intervention is. Fianza also says that Greece is unusual in a number of different, a number of additional ways to the rest of Europe, in that there isn't much of an infrastructure in terms of providing any kind of support to homelessness because it's a relatively new phenomena. I mean, this gathering aside, in terms of a formal effort, there isn't really a coordinated effort nationally. There isn't in the Greek constitution a guaranteed right to housing. Housing as a human right is not there. There is a special consideration given to people who are homeless as far as they will go, but not in that same way guaranteeing as a right, which has implications for what is socially, are we socially obligated to do in Greece in terms of homelessness. For example, in New York City, there is shelter as a basic right, and that puts a lot of pressure on the city in terms of legal mandates that no one can remain homeless. People have to be housed in some either temporary or permanent setting. It's a matter of law, and lawsuits drive the system to provide some intervention. So the legalities of what homeless people are entitled to does have an effect on the system that's set up. The other thing about Greek homelessness that's quite unique is that the level of home ownership in Greece is estimated at 74%. Even though a third of that housing is not in great condition, it is much higher than most other countries. There isn't much of a rental market, so that has implications for what kind of housing would be available for people who are homeless if they can't go all the way to home ownership. The data is surprisingly, frankly, as a national statistic of 11,000 homeless, low, and there is a belief that because of the strong kinship system all the sigenists that are helping out is actually concealing the level of the problem, because people are taking relatives in and assisting, so that when you go to count homeless people, there are fewer of them that are visible there. So that's just a kind of a background of it. And many articles are now beginning to appear about Greek homelessness. And I offer this as a kind of caution from lessons learned. There's an industry of homelessness research. And what happens with homelessness research is that people start to describe the characteristics of the people who are homeless. Of course, they're poor, they have mental health, they have addiction, they have histories of incarceration start to add up, arrests and so on. They're heavy users of the system. And I have to tell you that for every adjective that you add to homelessness, it becomes another level of separation between homeless people and people who are not homeless. And that's a path that I don't think you want to go down in terms of having an empathic or a socially committed response. Because the truth of the matter is that the person who is working very, very hard, 2 jobs or 3 jobs to keep themselves or their family together, loses that job, becomes homeless, goes on that adjective checklist from being hardworking, industrious, caring about their family, to suddenly not industrious, having psychological problems, maybe using alcohol or drugs to take care of their pain. And it's not as if they didn't have these problems before, but there is a tendency to characterize poverty as a character problem rather than a problem of not enough money. And it happens very quickly. I mean, it's rather astounding to me to read the sort of general press about these Greeks. Who are these Greeks? How did they go from 2004, when they were like brilliant and got the Olympics together and so industrious, and they managed all this incredible spectacle that was only 8 years ago, where they were like at the top of their game, to now these same Greeks, entitled, overprivileged, not working hard. So as you move into poverty, the general adjective checklist, not only personally but almost nationally, begins to skew in the direction of characterizing the have-nots as different from the haves in a way that is quite disparaging. So that what happens, and this is, I find this sort of extraordinary, is that throughout Europe, Canada, US, Australia, everyone, and not here because there isn't an established system, but wherever there is an established system of care for people who are homeless, it looks a lot like this. In Finland, it's actually called the staircase model. And throughout each of these Western countries, there is the belief that homelessness needs to first treat the person, make them better, and then they will deserve housing. So people earn their right to housing by first complying with treatment, controlling their addiction, getting their symptoms in check, and then moving on. The truth of the matter is the system works rather well. Most people who are homeless for a short time. The people who remain on the street are the people that this particular system doesn't work for, and those tend to be also the people who are most in need of mental health or other treatment services. So that what we have is a public perception of homelessness, the street homeless, which characterizes homelessness in general in a more severe way, or in a more complicated way than it actually is. Most people, for example, in the States fall into homelessness for about 2 to 4 weeks, and then they either get a job or bounce back, because they comprise the insecure housing or jobless group. The group that remains chronically homeless are people who, because of their mental health or their benefits being cut, or in some way some loss of entitlement, creates a system where they can't get back in. If you're very poor and disabled in any way and you lose housing, it's very, very difficult to get back into housing. You need a lot of support, both emotional, social, and financial, to make that leap in. Just to give you a concrete example, somebody in New York living in an apartment is hospitalized. They have depression or bipolar illness, or they go to the hospital. They are unable to pay their rent. They come back out. They have the option of basically going to a shelter. The only way they can get back into another apartment is to come up with a month's security deposit or two, or maybe a broker's fee, new furniture to get in. That's about 3 months' rent. There is no way someone on disability benefits can save that much and still survive on the street. So the income, people are priced out of returning into homelessness and end up in these kind of transitional temporary settings for a very long time. And these settings are not set up for that kind of work. There has been a great deal of attention to people who remain chronically homeless, and most of my work is really with this small subgroup. And I offer the program description that we developed for this group, which has been extremely effective, as useful in the sense that some of the principles that we use to start the program to address the problem of chronic homelessness may be instructive in the conversation we're having about where do we go from here. This is sort of the map of a street jail, hospital, shelter for the chronically homeless. There is this famous, the Malcolm Gladwell article of $1 Million Murray. Have any of you read that, by the way? I don't want to repeat. A guy in Reno, Nevada, Murray, who is a veteran, who is a schizophrenic, who's been on the streets of Reno for about 10 years. And the police officer that is on the downtown beat goes with Gladwell, who's the author of the story, and follows Murray's track record for the last 10 years of where Murray has been. He's been to jail lots of times. I mean, and the police often complain that they have to corrupt the law to do social work. You can't bear to leave someone out there in the cold, so you end up arresting them for vagrancy or some other minor level crime just to bring them in from the cold. He goes to the hospital a lot. He goes in and out of detox. But he, over 10 years, has remained homeless and has used over $1 million worth of Reno's services and still nothing of it. And that's what the acute care system, where you require people like Murray to be sober or in treatment before you offer them housing, and often housing is held up as an enticement for getting treatment together, and the result has not gone well for people like him. The program we invented with people like Murray, and I have to say that credit belongs to the consumers. And I would urge you to, when you're thinking about program design, I guess that before you even enter into the content of what the program is about, I think it's useful to think about who designed the program. Is it designed by providers for consumers, or is it designed by consumers for themselves? Has there been an input from the right stakeholders? Because without input from the right stakeholders, you can design all kinds of systems, and they will work somewhat, but they won't work for that particular person unless it's in some way meeting their needs. We started with homeless people who had multiple complex needs, people who had schizophrenia, people who had addiction, people who were on the street, and we were at a loss to figure out what to do. And it was through those conversations that people clearly said to us that they have had diagnoses most of their lives. Homelessness is an acute, episodic economic situation. It drives their lives daily on a survival basis. They don't want help with addiction or mental health. They want help getting off the streets. Housing First is the name of the program we developed, not because we thought it was a good idea. We weren't even certain that people would be able to manage in an apartment. But Housing First was the thing that consumers requested as their first demand and first urgent need. So our job was basically to remove the barriers to permanent housing and take people directly from the street into apartments of their own. It's very simple, but it's also challenging to implement because most systems, for example, people go into housing from the street are not particularly attractive tenants, so you need support in obtaining the housing. You need financial support in signing a lease or a co-guarantor. You need service support that visits the homes. One of the most amazing programs here in Greece is η βοήθεια στο σπίτι, which is it's a preventive program finding widows and widowers who live alone without ever having been asked, and they make house calls, social workers and a nurse, to all of the rural areas and urban areas of the country. 4,000 of these people serving over 120,000 elderly Greeks and keeping them out of nursing homes and institutions. And it was something that was totally proactive on that side. The challenge of Housing First programs where you're renting apartments and requiring people to leave the hospital or the clinic and make house calls sounds easy, but you have to kind of take apart all of the bureaucratic and other structures that would prevent the flexibility of a program like that to operate. People have to go and make house calls. That's the only way it's going to work initially. So the other part of the program is that people don't want to live in institutional settings. We typically rent apartments throughout the neighborhoods so that there's a social inclusiveness or integration. The services manage to support people. So we get them in by removing the barriers, and we keep them in by providing the social services. It wasn't a welcome program initially, as you can imagine, because all of the business in between transition, shelter, and everything else, is not required. So it has, though, implications for how you can spend money to provide homeless services, not in transitional settings, but in permanent housing settings right away. The program has been spectacularly effective. We have an 85% success rate in taking people literally from the streets and putting them into apartments with the right kinds of supports. Many other cities have implemented the program now. We operate it in 4 cities in the northeastern part of the United States, in DC and Philly, Philadelphia, and New York and Burlington, Vermont as a rural model. But there have been multi-site studies of its effectiveness done by the Veterans Administration, by Housing and Urban Development. There's right now a 5-city randomized controlled trial going on in both Canada and in France using Housing First to take the street homeless person with complex needs into Housing First. So it's been, and it's not the compelling narrative that has sold the program, if you will. It's been the data. And everywhere across different places, the data has been very, very strong. A couple of just sideline things here. The strategy of offering housing right away is a little bit at odds with many approaches that say that people have to earn housing. Housing as a basic human right is the way we offer it. And that has a certain value implication in terms of the way that the person is treated. It's not from some of the conversations we heard yesterday. One of the presentations talked about sort of the philosophical roots of charity, and is it pity, or is it giving of empathy, or giving of a kind of a compassion, as opposed to a giving out of a sense of social justice, giving because the person deserves to have a place to live, or that from the belief that we all deserve to have a place to live, and including those among the poor in that class. It has a different set of expectations, and has a different feel for the person receiving the services. In most programs that are set up to serve homeless people, the predominant response that the person can have is gratitude. It doesn't really invite input. In the program I'm describing, the person is the driver of the program right from the beginning. how can I help you is the first question. The person typically says housing, and then that question is repeated over and over again. How can I help you next? And what's the next thing you want? What you're doing is you are building, you're not only providing services, you are supporting the decision-making capacity of each individual. People talk about providing fish versus teaching people to fish, and in this model, the teaching is there from the beginning. It's a consumer-driven program, which means that the provider is there to support the consumer's decisions, and that person's sense of determination, self-determination, and mastery are developed right from day one, because right from the beginning they're choosing where to live, how to live, what they want to address next. In the data, we see that with that kind of an approach, people actually get better psychologically. So not only do they do well in terms of engaging in the program, but they also do much better in terms of reduced addiction and improved psychiatric symptoms. The other part of the program, I think, that really has driven implementation is the cost. It's actually much, much cheaper to put a person in an apartment with these very sophisticated support services than it is to do just about anything else in the homelessness industry. It's cheaper than a shelter, it's cheaper than transitional housing, it's certainly cheaper than jail, it's certainly cheaper than hospital. That's a very, maybe surprising, but very compelling piece of the evidence in terms of cost. And I think most permanent housing programs have shown this kind of data. It's in one of the studies done by Culhane at the University of Pennsylvania, actually housing someone with support services cost about the same as keeping them homeless. So because I think there's an assumption that homeless people don't cost anything, but in fact the ambulances and police and detox and all these other acute services are a cost, and often more. But so there's moral, compassionate, clinical, and economic reasons for doing this. What happened after that, I mean, you know, harm reduction is, of course, a part of the program. That sort of social justice perspective is a part of the program. It's the only evidence-based practice. SAMHSA stands for the Substance Abuse and Mental Health Services Administration. It's a federal agency in the United States that reviews the evidence-based for programs that are doing all kinds of mental health and addiction services and homelessness. And after reviewing our data, we were entered into the National Registry of Evidence-Based Practice, which really sprung a tremendous amount of interest in dissemination, and that's what the yellow dots there represent the programs we operate, but these other red dots represent the dissemination over the last 10 years, really. And here's the piece that I think may be relevant or more of more interest to you, because it concerns how the role of foundations and how a lot of this dissemination has taken place. The first example I have is DC. This was about 8 years ago. We were running programs in New York. Even though we had the data, we had published in peer-reviewed journals, people would still say, you can't really do this here because New York is different, it's a unique place. And so we were compelled to try and replicate the program. In DC, we had the Department of Mental Health inviting us. We had also the Housing Authority offering us the vouchers, which is in the States the rent stipend for these apartments. So the bulk of the money ongoing, the sustainability, was already in place with this invitation. We couldn't start the program because the city didn't have enough cash to basically let us hire staff so we can bring in the clients. Once we had brought in the clients, we could bill Medicaid to pay for staff services, but the startup costs were a hindrance. So we approached the William Abell Foundation, and they were persuaded by the evidence, and they gave us a grant of $250,000 so we could start that year. Our deliverables were that we would house 75 of DC's most vulnerable who were on the street for years, and most communities actually, when you gather the providers together and include the police and the emergency rooms, will be able to tell you on a list who it is that needs to be housed. We delivered on that first year, and then the Abell Foundation gave us startup money for 4 more teams. This was really something that the city noticed. Mayor Fenty, committed to addressing homelessness in DC, adopted Housing First through his Department of Homeless Services and began to close down shelters in DC and offer people permanent housing through that policy. None of this would have been possible without the startup. Mr. Villar, I think, gave us an excellent vocabulary yesterday, the acupuncture approach of that first team, seeding the money to draw down the government funds, and then the horticulturist seeding different programs throughout the city to create systems change. It was rather interesting and amazing to participate in that. In Sydney, there was a stakeholder group that wanted to take care of street homelessness in one particular area of Sydney. Just to put this in perspective, we talked about 11,000 street homeless in Greece. There's about 40,000 people, 40,000 families that show up for shelter in New York every night. 10 million. In Sydney, their last street count showed 373 people. I'm like, what's the problem? But this was a great concern to them because it was up by 20 from last year, and they thought they were going in the wrong direction. They were building sort of congregate housing, and there was this group, the chronically homeless group. They had a stakeholder committee that included the United Way and the Freehold Foundation, included UBS Bank, and it wasn't a clerical level person. This was the chief operating officer of UBS, and the City of Sydney, a couple of other stakeholders. What was interesting for me to observe in that, they were approaching the federal government for money because these programs are, even though they're much cheaper than programs as usual, there's an investment. You need about $2 million if you're going to house 100 people in Sydney. One for the rent and one for the services. So you need the federal commitment right up front. The leader of that stakeholder group was not a foundation, it was UBS Bank. When UBS Bank called the Minister of Health or the Minister of Housing, we were able to get appointments remarkably easy. And then we would, describe the project and get investment. They invested in a program to house 70 people and doing extremely well in breaking the gridlock, which is all over Europe, frankly, between social housing and rental housing. There are, and the fianza people are trying to address this in many different ways. We don't actually have this problem in Greece particularly because there isn't a lot of social housing. But in the European countries where there is, poor people go to social housing, everyone else goes to rent or ownership, and that we're looking at a middle ground where very poor people are encouraged to rent because they can't make it into social housing because the tenancy requirements are rather strict. Here's another project we've been involved in, most significantly with funders and philanthropy, and it concerns homeless veterans. There are 70,000 homeless veterans in the United States. I'm talking about veterans of the current war, but going back all the way to Vietnam, that the Veterans Administration has, up until recently, almost abdicated its care for returning veterans. And it's sort of a national disgrace, and the people at the helm now, the Veterans Administration Secretary and the Housing Secretary, have joined together in a really remarkable partnership across huge federal agencies to provide vouchers and services for these 70,000 veterans. And they want to use Housing First to do it. And we're currently involved in a 14-city demonstration project because changing the Veterans Administration to adopt a flexible community-based approach is a whole other challenge. One of the ways philanthropy got involved here was that the government, for different reasons of legality, could not, the Veterans Administration can buy you guns and ships and planes, but they can't buy you furniture for an apartment, and they can't give you a broker's fee, and they can't provide all of the kinds of things that make a home. So we approached a group called Funders Together because we needed a very small, relatively small amount of money in each city, somewhere in the area of between 150 and 200,000, to launch these programs that would really draw down millions of dollars of federal money. So the leveraging was enormous, and without that help, we couldn't get it done. Funders Together, you might find, is an interesting philanthropic experiment. It's a national network of funders, some of the largest foundations in the country that have created a separate 501c3 called Funders Together, and they work as a board jointly to make decisions about what philanthropic efforts to support. They started with the awareness that philanthropic money is insufficient to make an impact on deeply embedded structural societal problems. I mean, this has been part of the conversation. What is the role of philanthropy, and can you replace government? And they have already come to the conclusion that that is not really the role of philanthropy, but there is a targeted and very useful role, as demonstrated by this Veterans Administration project, where you can fund evidence-based practices, you can take measurable risks in startup, you can be a convener, and they've been extremely helpful in this because the central group of Funders Together is now working with philanthropic organizations in the 14 cities to get this startup money funded for this project. A funders to funders kind of request is a whole other conversation than providers competing with other providers to a foundation, and it has made the effort much more successful to work in this collaborative capacity with them. So, with that leverage, you're able to draw down the federal funds to go through. And this is my my last example here. I'm going to talk about Philadelphia for a minute because it's really it might be instructive in terms of what do we do in Athens today. I thought I interviewed the former commissioner of homeless services in Philly about this issue of addressing homelessness in a crisis situation, and he's been quite skilled at this. What they did in Philadelphia was to consider what they had. What do they have in hand? The city of Philadelphia, like Athens, has many abandoned buildings, has many public buildings that are not fully used. I'm including here schools, churches. They have a number of services that are paid for around the clock: police, fire, medical techs, other services, sanitation perhaps. So that what they did in Philadelphia was to take places like schools, churches, abandoned buildings. Philanthropy came in to buy the cots, food, sheets, the sort of the material things that would basically change by night these public buildings into emergency shelters. They had invited nonprofit groups to do assessment and treatment in the shelter. The police had to leave their desk jobs and spend their shifts doing supervision, and they basically were able to cobble together an emergency shelter system that would meet with homeless people, do an assessment, and provide guidance and disposition appropriately as needed for the person they were meeting. So it does require an enormous amount of coordination, and in a way, the philanthropic community was in a much better position to get city, state, religious, nonprofit, all of these groups together to collaborate in this way and pool existing resources to come up with an emergency shelter solution in a city that didn't really have one in hand. So that's, it does require an enormous amount of interagency collaboration. And I'll just conclude with these two thoughts. To put homelessness or solving the problem of homelessness into one agency, and I think the mistake would be to put it into some social service corner or something about people with problems, will not give it the appropriate power or authority that it needs. It's a complex problem. It's really about addressing poverty, so there's labor, education, housing, income disparity. All of that needs to be part of the conversation, because immediately after people are housed from being homeless, they want a job or a life back, and so it's best to anticipate that right away. And the other part of this is really not to make homelessness something that is about other people. It's really about all of us. And when I referred earlier to the labeling and the ownership, and this in part needs the help of experts maybe in the branding or public relations world, that the cost of homelessness is not just to the homeless person. I mean, of course it is, but it costs every one of us to walk by a homeless person, not to deal with them, not to respond. It creates a kind of beginning of a dichotomy or diffusion in our society that we all pay the price for. So I think that to somehow convey the full societal obligation to address this problem rather than a subgroup problem, I think is a key messaging point. And having been here for the last 2 days and seeing the incredible things that have been done before, I'm sure homelessness can be ended. It's not a cancer, it's not Alzheimer's disease, it's not something we don't know the cure for. It's actually very curable. We can end homelessness. It just requires the right planning and thinking and investment to do it. Thank you. Question? Oh, microphone, right. Yeah.
I want to ask two things. First of all, how relevant is this model to the situation in Greece whereby homeless are more of a recent phenomenon and it's not a chronic situation such as the customers that we're used to working with at the National Personal. Secondly,
I'll repeat the question. I'll repeat. I'll repeat the question. The first question is, how relevant is this model to Greece where there isn't an established system of homeless services? I think the relevance here is in lessons learned about what not to do, so that you don't want to create a stairway model when you don't have to. So that in the approach, let's say if you take the Philadelphia approach of creating makeshift shelters by collaboration, you don't want to create or invest in transitional type programs or stairway programs. You'd want to invest in quick assessment, prevention, and placement into permanent housing.
The question was more in terms of how the people that are found homeless here, or the majority of the population in Greece, is more of a new phenomenon, and the people who are not chronically homeless, so the characteristics of the people themselves are different. And what kind of similarities would you envisage with the people that you usually work with, which are more chronically, with a history of mental illnesses, etc.?
Well, I think that two things, at least. One is include the stakeholders in the solution. So I would start with the principle of consumer participation or consumer choice as part of the program design. The other is to separate out the problems, the many problems people have, unemployment, income, health, from housing. I would keep those two domains very separate and not make one contingent on the other. just as sort of guiding operational principles, I think that'll spare you some confusion in the implementation.
And one more final one, I promise.
Well, the other thing is that, you know, the largest group is people who are foreign. So I think in that sense, a collaboration in Fianza or with the rest of Europe, because this is not a unique problem to Greece in terms of what do we do with people who are not of here. It is the fundamental question all across Europe, ever since the walls went down. And so that, I think, is going to require a policy-level decision both locally and at the EU level.
And finally, what is the average time with the consumers that you work with housing, with the Housing First project? The average time that the person needs after he's provided permanent housing to stand back on their feet, find a job perhaps, get better with their illness or whatever the issue is?
It completely depends on what they come in with. I mean, this is not a program that, if someone is out of a job, you wouldn't go and offer them an apartment. You'd offer them with something with assistance about getting a job back if they're work able. This program was really more for people who were disabled. Let's say, if you imagined that the economic crisis is over and people can get jobs, and so all of the people on the street today that can't get jobs get a job, who would be left? Who would be left still on the street? Let's start with that. So that's the group that you're going to target and for this kind of a program. This is a pretty intensive program. For the other people, you can work interventions light so that if some people, you could have, you know, job fairs, employment, these kinds of economic solutions. When people do come into the program, the ones who are left, how long do they need it? Completely varies by the person's ability to recover. Some people recover in 6 months, some people a year, and there are people in the program that we've been working with for 20 years. These are people with pretty severe diagnosis, and I think what's remarkable is that 50% of the people recover at all. We didn't know until recently that things like schizophrenia can be recovered. We thought they were lifelong diseases, if you will, and people got worse over time. It's not true. I mean, it's not true because of our program. It's not true in World Health Organization's research data. Mental illness is a recoverable disease for 50% of the people. So that's like hugely different than setting up a system of care where you institutionalize people because you're assuming they're going to need that help. Here's the cool thing about the program. People get better from mental health and addiction quicker than they improve their poverty rating. So then you don't have to move someone. You still support them with the rent, but you can take that social service piece away because it's not attached to the apartment and move it to help someone else. So you can titrate it down as needed or move it all the way away if the person doesn't need that support. That's why it's important to keep clinical and housing separate.
Good morning, Ilias Poulias from the Poulias Foundation. Do you have numbers? I mean, what you said, the example of the person that cost over the 10 years $1 million has a great impact. It's fascinating. What you do versus the person remaining on the street being a homeless person, what that costs as a percentage of the GDP or to the country versus the cost of what you do. Can you put it into numbers? Do we have data like that?
Yes.
Thank you.
There are lots of cost studies for this model. There are over 35 cost studies, and I'd be happy to give you our website reference or talk to you afterwards. Most of them are pre-post studies. They're not a randomized control trial. So that what they do in these studies is they look at all of the social service use in the year or two before the person goes into the program, and then for that same cohort of people a year or two after they're in the program. In one recent study last April in the Journal of American Medical Association, a very good journal in terms of peer review, they had a $4 million reduction for the 75 people that went into a Housing First program in Seattle. That's they had targeted people that were frequent users. So there is a caveat to the data. If you're going to take, some people who are homeless will not go anywhere near a service. They're hiding under the bridge or in the parks, and they don't really use services. For that group, you won't see such a dramatic change in cost. If you target the group that is using services a lot, you will see a very dramatic change.
Good morning, Maria Liga. Are there some of them, as a percent, that they want still to stay in the road, on the benches, as they believe? They don't want to answer to your efforts? They want to stay on the road?
Oh. You mean if that's their choice, that they don't really want to enter the program and want to stay outside? That happens, I think, and you respect that. That hasn't been a big part of the problem, frankly. I think that one of the issues with people who are refusing the program initially is that they don't believe you. They don't really believe you're going to give them a place to live with no strings attached, that it's just going to be theirs. Because people have been homeless for a while, have had invitations, come, we'll give you, what would you like, a place to live? We'll get there, let's go to this program first and this program next, and they end up spending a lot of time not getting where they actually want. So there is, for some people, a longer period of engagement. These are some of the nuances of the program. We hire people to work on the teams who have been on the street. So somebody comes into the program, they get an apartment, they're doing much better, we hire them as an employee. That does two things. It demonstrates to every other employee what can be accomplished from the people we're actually serving, and it bridges the gap in credibility for the people you're engaging and inspires them, because the person can legitimately go to that person on the street and say, I've been where you are and your life doesn't have to be that way. So the hiring of peers is a very good way to take on that challenge.
Thank you. Good morning. My name is Yorgos Kaminis. I'm the mayor of Athens. So Athens is a latecomer concerning the homeless phenomenon. It is because of the recent economic crisis and because of the illegal migration that from one day to another we have a phenomenon of 11,000 people all over Greece being homeless, as you said. So we can have an advantage from your own experience, because it seems to me that the way that you address the problem is a new approach, finding directly a house. And you said you have an 85% of success. What do you exactly consider as a success?
Thank you for your question. I consider success housing stability, immediate access, so that the person doesn't wait more than 2 to 4 weeks to get into an apartment, and once they're housed, that they stay there. That's my measure of success. On the housing, I actually also, without putting pressure on the person, expect success on the mental health, addiction, and employment. But here's a mistake I've made. Because I was trained as a psychologist, everything was focused on mental health and addiction and the treatment services. Freud, Freud, Freud. But it's also Marx. And you need to pay attention to the economic recovery. The economic recovery for that person, we didn't know they could work initially. But now if I were to design the program from the start, I would include people who are focused on employment right from the beginning. I think that would improve your outcomes even more. In the research on what they call supported employment, where people are encouraged to get a job, they're looking at 1 hour a month as a success. So no one's going to go from street homeless with schizophrenia to full-time employment. But I think that the bar is set so low, at least from a production perspective, because the person shifting from believing they are a recipient of services, sick, and must be helped all the time, to believing they can get a job is a huge psychological change, and then manifest by getting a job at all is a tremendous starting point, and it grows from there. But that's how we would measure success. And we don't measure community impact, but if we had the opportunity, that would be an interesting measure too. There's someone with their hand up in the back there. Oh, sorry.
Athena Linos from Prolapse. I wanted to ask you, what you suggest is if we build the intermediate steps, going from homelessness to shelters to the other steps before going into permanent housing, we will create obstacles both from the people that need the service and from the intermediate services themselves. So the suggestion is, don't even try to have the shelters, go directly to permanent housing.
I'm sorry, I didn't quite understand the question is about
the intermediate steps.
The intermittent steps, right?
Being obstacles both from the part of the individuals, of the recipients, and from the intermediate steps runners or themselves. Right. So for Greece, that it's a new program to be developed, you suggest don't even use the intermediate steps.
That's what I'm suggesting. But I have to get back to principle number one, which is consumer choice, okay? So that to me is the reason for the success of the program is that the client is driving. You are in the back seat and they are driving the car. If the person wants to go to detox or they want to go and get treatment before they go into housing, I would take them there. So it's not my prescription for housing first. It's 99% of the time the person's choice to go there. But they will, you know, it's not, I'm not suggesting you do away with services, but you need detox, you need mental health services, but they can be the usual community clinic services that are already in place or need to be enhanced. What you're trying to do is move homelessness not into an industry, but into a quickly solvable problem. The person goes to a house, and then they go to a clinic or a hospital like everybody else, and they come home. Not a program for transitional, endless treatment and then housing. Does that answer your question? People in the back there have their hands up.
Good morning. I'm Rubini Terzaki from Kid and Family. My question is how you deal with the government to get some schools or empty houses to use it, because in Greece municipality government does not cooperate at all. So what I propose is that maybe foundations could guarantee that or deal with the government and municipality, because that could offer much help to groups. What you propose?
No, I think that's like exactly the right kind of leverage for foundations. I think foundations can convene and leverage their resources contingent on government cooperation. I think that's a great strategy. We're done. Okay, we're over time. Thanks again. No.